So from the very first step, you're bending forward.
Yeah. It's this side.
So maximum around 50 meters.
I think maybe, yeah. So, but even while I'm walking now, you know the sensation of my front of my shin and this area here, yeah. I feel it, but I walk without it.
So as you're walking, the pain is progressing, increasing.
In here, this side, yes.
And up. Just like the pain is from this gluteal region,
Yeah.
and then going down.
It comes round, you know,
In
front of the shin.
Yeah. So that is typical L5 distribution. So like I'm touching both the sides, so sensations are equal or there's some difference?
Equal, yeah. Sensation is fine.
Okay. Pull your toes up. Okay, bow is good. Press down. Alright. So first we do the straight leg raising test on left side. There's no pain. Correct. Bend your knee. Your knee and hip is okay. Then we do the SLR test on the right side. It's around 30 degrees. Okay, bend your knee. Your hip is fine. Your knee is okay. Right. So ankle jack is present on left side. On right side, yes, there is some contraction. Alright. At the same time, we'll examine whether your pulsation are fine or not, because sometimes the vascular deficit can also cause similar symptoms. That pain on the right side, correct?
Right, yes.
So your MRI is actually a deceptor.
Okay.
If you look at it,
Yeah.
this looks like the pathology, but actually this is not causing any problem. Reason being, this is L5, 4, 3, 2, 1. This is practically L1, L2 or L2, 3,
Okay,
the
yeah.
way you count it. So there are no symptoms in the nerve which is supplying your like upper thigh and this area. There's no pain in this area.
No.
You had pain in the leg and down.
Yeah.
So this is the problem. And if on this MRI you look at it, it looks absolutely normal.
Yeah.
But when I look at the axial view, let's first look at the normal. This is a normal disc.
Yeah.
Rather, this is a normal disc.
Okay.
This is the spinal canal, and you can see these small dots.
Yes.
They are actually the nerves which are traveling down.
Okay.
These are the nerves. So we are taking a cross section.
Yes, yeah.
And you can see on the left side as well as right side, it is open.
Yeah.
But if you go to L4, 5, then you can see that this is the disc coming out, and it is blocking the right side. Left is still open.
Okay, yeah.
Right is blocked. So
Okay.
this small disc,
Yes.
this is the pathology. And
One second.
sixth day of the surgery, and Mr. Harmail Singh is with us. We are changing his dressing for the last time because endoscopic technique doesn't need much of the dressing because there's no bleeding. You see, everything is absolutely fine. Even if I'm pressing, there's no blood coming out, right? And this is a very small incision, just 1.5 centimeter, absolutely clean. So you don't need any more dressings now.
Okay.
This is the last dressing, and after 5 days you just take it off. And then you can send me a picture.
Okay.
Dressing, and no further dressing required. That's it. So can you summarize in few lines your experience? It was sort of adventure for you, coming all alone.
It was, but I think, previously checking your, previous social media and various, information available. I had some sort of, 90% confidence. Of course, any surgery, this was the first surgery I've ever had. However, when I came here and the way that things went so smoothly and efficiently, I must admit I was very, very impressed.
Thank you very much.
And I'd certainly, recommend people that, not to be fearful, and that it sounds worse than what the actual process is. But I can say that now after the event. So, but it is, very, very pleased.
Your family was not very much in favor of you coming here and getting operated.
No, they weren't. They were very much, what it was is I was enduring pain. I'd been through this for about 4 or 5 months. And with such sort of long waiting lists and even going to the private health route, it was still a 6-month waiting list. I just couldn't endure the pain much longer. Although, I have quite a high threshold of pain, but I'm glad I made the right decision. Really am.
Okay. So, what's the reaction of your family now?
Oh, very much. They're very pleased. In actual fact, they could. You know what? I don't know if it was while I was still under the anaesthetic, but on the night of the surgery, I was walking in because I could only get Wi-Fi signal in the corridors clearly, and I spoke to my wife and my children, and they're so impressed. I couldn't believe it.
So that's the beauty of actually endoscopic technique, that we are able to give something people can't believe. Fast recovery, there is no trauma to the body, and means just for first few days you feel sore at the operative site, but after that it comes down drastically. In the first week. So you are traveling tomorrow?
Yes. I'll fly out tomorrow afternoon, I think 2 o'clock.
So I hope that next time you come to us, you come as a friend, not as a patient.
Of course.
And I would love to see your family if they are here next time.
Yes, obviously, whenever we get an opportunity, we'll do. And likewise, if you're ever in the UK,
thank you very much. Thank you very much.
We can always get together.
Yeah. And I think it's a big compliment for the education system and the accessibility of healthcare in India.
Oh yes.
I think everyone appreciates that. Now we have people from all over the world coming here. Means it's not just about the low cost, it's also about the quality that we are delivering.
Absolutely, yeah.
And of course there's no waiting list.
No.
In spite of the fact that we already have such a huge number of patients.
Yes.
But still we are able to accommodate.
No, I really do. I think it's certainly the best thing that I ever did. Yeah. So,
and
thank you very much, really.
I want to thank my anesthesia team and the people who are working with us for such a wonderful result. And
no, absolutely. The whole team, from start to finish, I can't fault anything really here. I think it's an absolutely fantastic setup.
Thank you very much.
The team are so professional, and I don't think there's no corners cut. I think you go over the top to make sure you make the right.
Thank you. And in future also, God forbid, if there is any issue, any problem that you face, yes, we are always there. You have the numbers, you can contact us anytime.
Thank you.
So there's no, do not have to take any appointment. Just call us, we are there.
Thank you very much. Yeah.
Wish you all the best.
Thank you very much.
Thank you.